think every resident needs simulation, and that's the way that training is going. It's the modern way to train rather than immediately learning right on a patient. We're able to do it safely in a very realistic fashion in a simulated area on, imaginary or fake patients, but make it a very realistic setting so the residents get their first experience of doing things, delivering a baby, doing a surgery on a simulated patient rather than doing it for the first time on a real patient. In OBGYN, it plays a huge role. So I'm so excited that we actually finally have this center here that we can do this in kind of more extensive fashion than we were doing before. It plays a huge role in the residents learning how to do all of the clinical skills they need to do. So again, delivering babies, doing C-sections, surgeries, just evaluating the patient. And then we expand from the basics of the skills to handling the emergencies, the complications, and doing it in then a simulated but more stressful situation to get them to know how to handle an emergency when it happens for real, that they're prepared, that they've been through those things. It involves teamwork. So we have multidisciplinary approach on the floor when we're actually taking care of our patients. So we do the same thing here when we do simulation. So for us, labor and delivery, the nurses on labor and delivery are a huge part of the patient's care experience. And they're the ones that are really in and out of those patient rooms and really the first line as far as noticing if there's a concern for the moms that are there in labor and delivery. So we want to run through all of the emergencies with our nursing staff too, so everybody knows their roles. It emphasizes the teamwork, the skills, the medications, the knowledge of how things should go, so we're keeping our patients safe through those events. So we do them all here in a simulated fashion. So these emergencies that we don't see very often are still things that we've practiced often.
Well, traditionally, like most medicine, obstetrics has been something that you gain experience over time by patient care. And these types of obstetrical emergencies don't happen every day, so it often takes years to accumulate competency over time. Sim labs will help training physicians to gain that experience in a matter of days or weeks rather than years. And so the first time they face those type of emergencies, they'll already have a lot of experience under their belt. For older physicians, they'll give them a chance to update their skills as those treatment protocols change over time.
So my residents have protected academic time once a week on Thursdays. So as part of that, about every other Thursday, we're doing about an hour or two in the sim lab. And then the other purpose of it is we actually want to make it so the beginning of each rotation, we're bringing our residents down here just to run through those skills that they're going to be using during each rotation that they do. So it's kind of a refresher or a skill builder each time to look at where they were in the past and build those things as they're going through their training. We're also going to be using it to take over some of the drills that we do for labor and delivery. So we help the nurses in the units do their required training drills as well, because again, we need all the different roles present to make the simulations real, and everybody needs that training. So I foresee that we're going to be doing those monthly or every other month also down here in the Sim Center. They've also made it so it's available. So if we find that we want to do additional training in our teams or with our medical students, so bringing our other learners in, we really just have to just coordinate that. So it's a very open and flexible schedule at this point. And I think as we use it more and more, we'll come out with more ways of how we want to work it into even our everyday training.
Because we have new physicians coming into the practice. We have midwives coming into the practice who also would be, relatively fresh out of training and would want to improve their skill set. And also it's more than just an individual physician or nurse midwife taking care of the patient. It's certainly a team effort, and having the providers work with the nursing staff in collaboration to take care of patients is important. Even as each individual has their skill, it's important to work together as a team, and this would give us a setting to do that.
Absolutely, because this is something that is not just the education part of the hospital. Everybody needs to go through those drills and that simulation to hone their skills and to prepare for emergencies. So for Partners in Women's Health, I mean, they're taking care of their patients side by side with us on labor and delivery, and side by side with us when we're in the OR doing surgical cases. So they'll be involved in these drills and coming down here for simulation as well. And I foresee that's something that they'll be doing with every level of their folks, be it the midwives that are coming onto labor and delivery, helping them to run through emergencies with their physician backup. So again, everybody's prepared when these events do occur. And even just for routine care, it's just going to help keep everybody's skills to the highest level.
Some of those procedures are as simple as putting in IUDs, doing endometrial biopsies, office-based procedures. And traditionally that was, see one, do one, teach one. In once again, limited experience before you were in a setting where you were providing patient care. This will allow them to do that in a simulated sense well before they actually touch a patient. For somebody like me, I've worked for 30 years. I haven't resuscitated a baby in 30 years. So, but it's one of those things that we're always concerned about in case the neonatologist was unavailable. We would want to be able to do infant CPR. This would give us a chance to practice that prior to being in a true emergency.
We're just seeing the start of the things and the capabilities that we're going to have here to train and to do things. So we're really very thankful for everybody that's supported the Sim Center from day one, because it's really grown from its first conception. It's far surpassed, I think, everything that we initially thought we could potentially have here. As new techniques and things come out for all of the different specialties, including OBGYN, there's so many more things that we'll need to train and learn and do, and new ways of doing it.
Well, one of the things we do, or have tried to do, is for emergency C-section, for instance. These are often done in a really fast sequence. And if one of the problems we had in the past is everybody would show up, there wasn't an assignment for people. So you might have 5 nurses in the room, but not necessarily every job that needed to be done was being taken care of. So something like this allows you to have it more structured, where we have extraneous people removed, so you reduce the chaos and the noise. And then the team members that we need to have, we can assign kind of a position 1, 2, 3, and there's duties for each of those positions, so that we make sure that everything that needs to get done gets done with the fewest bodies in the room as possible. And so that's where the development of a team and practicing as a team comes into play.
One of the other focuses here for the Sim Lab is education. So it's education not only from my standpoint in medical education for my residents, but it's education for the community. It's education for everybody that's working here at the hospital, the nurses, the mid-level, so the nurse practitioners, the PAs, the techs. Everybody has a role where they can come in and learn in the Sim Center. The community. So I know they've kind of talked about a way to get EMS and the fire department in here, because again, they're the community outreach, and this would be a wonderful location. I've taught obstetric emergencies to the fire department before. This would be a really great location to do that with equipment to prepare those folks as well to handle whatever emergencies that they encounter in their community as that first line for us. So with that classroom, I mean, it provides a great spot for education and for outreach, as well as for everything that we do here at the hospital.
So every great story starts out with a good beginning, and we've had a number of the industries here in Newport News help get this started. Hyundai and Ingalls Industries in Newport News Shipbuilding, Riverside Regional Medical Staff, WM Jordan, Town Bank, Spain Commercial have been very generous in getting this up and running and started. It's going to take an ongoing effort by the community to support this to get where we want to go. It's there's a lot more to be done, and hopefully we'll be able to continue to grow that with the community support over the coming years.